Welcome to another video for the Daily Remedy Show. Today we're going to discuss a controversial topic that has really garnered headlines in the recent days, particularly since President Biden issued a mass pardon for those with federal convictions of simple marijuana possession. And the question really being, is marijuana an effective substitute for opioids, namely prescription opioids? It's a difficult topic because it's controversial on many angles. If we were to break down the complex issue of drug policy in three factors, we would find it can best be understood in terms of the individual's relationship to that particular substance, the general policies around the restriction and the consequences of possessing that substance, and the general perception of the substance. Now, I use substance as a general term, but that could include anything from methamphetamines, prescription opioids, really just substance in general, because I think we have to broaden the conversation to make sure we understand it properly. We know the individual effects of certain medications. We know the effects of certain illicit substances on individuals. We can just look at any legal scholar to get a sense of what are the overall ramifications of possession of certain substances, be it prescription medications or illicit substances, to get a sense of what the policy is. But what isn't as clear, and what I think is probably as important as those other two, is a general perception of those substances. Because in many ways, perception reflects public view, and public sentiment drives votes, which drive political action. So what I did is I did a review on PubMed looking up opioids and marijuana to get a sense of what kind of clinical studies are available, particularly studies that go over public perception. I didn't have far to look because right here at number 2 was a national survey of US adults done by Ishira et al. Study conducted in 2019 studying substitution patterns for marijuana and opioids. Now, I would recommend everybody to go through the study themselves to read through the methods and how the data was collected. But for our purposes, I'm going to focus on table 2 because I think that's the most instructive. If you look at the table, you'll see the question. Marijuana users with opioids, did they ever use marijuana in the previous 12 months in which the study was conducted? They have the absolute numbers on the left and the percentages in the parentheses. The first thing is that they break it down by age, which I think is the most important factor. They start with 18 to 34, 35 to 49, 50 to 64, and 65 and above. Let's look at the percentages because I think that's the most telling. If you look at the percentage for 65 and above, which is typically the Medicare patient population, only 37% substituted. If you go 50 to 64, similar 39%. So what's interesting is that among the patient populations, 35 to 49, 50 to 64, and 65 and above, that are more likely to have chronic pain or chronic conditions with pain as a symptom, a fewer percentage substituted marijuana for opioids. But among a younger population that may present with acute pain or may have autoimmune conditions in which they start on opioids early on in their life, 51% used marijuana as a substitute. Now that's critical because it opens the door for Pandora's box of perceptions. Does that mean younger patients with opioids are more likely to abuse marijuana? Or are their pain receptors fundamentally different to the point where marijuana can be used as a substitute? It's difficult to tell because whenever you use public perception as a gauge for clinical discernment, you always find yourself in the realm of speculation. Is it that older patients with more chronic pain and more comorbidities are less likely to abuse their medications and therefore have a lower substitution rate for marijuana? Or is it simply because their pain receptors have developed differently to a point where marijuana is not an effective substitute? It's difficult to say from those numbers, but what's critical is that the pattern of substitution clearly shows a bent towards younger patients with chronic pain, with 51% more likely to substitute, and then the realm of 37 to 39% of older patients less likely to substitute. Let's now look at the gender. That again shows similar patterns. 39% for female, 42% for male who did substitute marijuana. I think what's critical to understand here is that there are general trends that you can infer. African Americans were like 40% compared to Hispanics, which were 48%, which is more in realm with other non Hispanics and whites. So, what that demonstrates is that those African Americans who have prescription opioids are less likely to abuse it. Now, that could mean they have less access, so the percentage of African Americans who do get prescription opioids are less likely to abuse or substitute them for marijuana. It's very difficult to say. And I think the idea here is that these surveys have quite a few limitations in the sense that they provide perceptions and isolation that do not go into the pathophysiology of the individual or the broader legal policies and the sentencing statutes that impact the punitive measures involved with taking a particular substance. So I think it's very important that as we start to advance this drug debate around substances, determining which substances can serve as a substitute for one for the other, that we do not just focus on perceptions. Because when we focus on perceptions, we'll find ourselves with thoughts that reinforce existing beliefs. Speculation that's fundamentally circular in nature. We have to take the perceptions of the medications, the substances, alongside the individual effects of those substances on the individual, alongside the legal ramifications and policy ramifications, the laws, the statutes, the policies that dictate the severity of having a particular substance or the permissibility or restriction thereof. All three together are needed in order to have a proper understanding. And I caution everybody, as we advance the discussion on drug policy, don't use this pardoning as a bellwether in isolation. It is a perception. It has to be taken alongside other factors like individual reaction to the substance and general legal policies that affect the punitive measures and consequences of having or using that substance. Those three together determine true drug policy. And with that, I thank you.